Happy day to all. I am Professor Dr. Pallavi from Department of Conservative Dentistry and Endodontics, Vinayaka Mission, Sankaracharya Dental College, Salem. Topic for today's discussion is irrigants used in endodontics. It shall be discussed under the following headings: objectives of irrigation, ideal requirements of irrigation, factors affecting the efficiency of an irrigant, classification of irrigants, commonly used irrigant descriptions, newly introduced irrigants, irrigation guidelines, technique of irrigation, conclusion and differences. Introduction. The largest proportion of endodontic diseases of both pulp and periradicular tissues is due to presence of microorganisms. Although mechanical and manual challenges of root canal debridement remain, irrigants not only are important for the removal of debris and dentinal chips produced during shaping and cleaning, but also are of critical importance in eradicating the intraradicular microbial infection. Objectives of irrigation are to remove the debris created during shaping of the root canal, to lubricate the root canal, to dissolve organic and inorganic tissues, to remove and prevent the formation of smear layer. Ideal requirements of irrigation. An irrigant should be germicidal, non-irritating, should have low surface tension, should remove smear layer, should be non-toxic, non-cariogenic, inexpensive, non-staining and easy to apply. Following factors affect the efficiency of an irrigant, such as volume and concentration of the irrigant, frequency of irrigation, temperature of the irrigant, length and time of intracanal contact, gauge of the irrigating needle, depth of penetration, diameter of the prepared canals, age of the irrigating solution. Grossman's classification of root canal irrigants are: most commonly used irrigants such as saline, sodium hypochlorite, EDTA, chlorhexidine. Other recently introduced irrigants such as HEBP or itridonic acid, iodine potassium iodide, antibiotic containing irrigants such as MTAD, tetracline, Q-mix. Normal saline. Out of all irrigants used, normal saline as 0.9% is commonly used as irrigant in endodontics. Functions of saline are mainly for gross debridement. It acts as lubricant, it acts as agent to any chemical irrigation and as a final rinse to remove any irrigant. Sodium hypochlorite. It is considered as gold standard in irrigating solutions. It is most widely used irrigating solution and 5% of available chlorine is present. It has got high alkaline pH. History. Daikin in 1915 recommended 0.5% sodium hypochlorite for treating wounds during World War I. Coolidge in 1919 introduced sodium hypochlorite in endodontics. Mechanism of action. Destruction of bacteria takes place in two phases: penetration into bacterial cell wall, next chemical combination with the protoplasm of bacterial cell and disruption of DNA synthesis. Mechanism of action can be discussed under saponification, neutralization and chloramination reaction. Sodium hypochlorite acts as solvent for organic and fat degrading carboxylic acids, thus transforming them into fatty acids, salts and glycerol. This reduces the surface tension of the remaining solutions, followed by amino acids which are neutralized by sodium hypochlorite, forming water and salt as shown in neutralization reaction. The pH is reduced with the exist of hydroxyl ion. Chloramination reaction next follows, breaking into chloramine and water. Thus, amino acid degradation and hydrolysis is done by hypochlorous acid and hypochlorite ions. Properties. Antibacterial activity is mainly dependent on the concentration of hypochlorite. 0.5 to 5.25% sodium hypochlorite can be used as an irrigant in root canals. The most effective concentration recommended is 5.25% sodium hypochlorite. 2.5% hypochlorite is commonly employed in concentration as it decreases the potential toxicity of the tissues. Tissue dissolving capacity. The sodium hypochlorite completely dissolves the entire pulp in 20 minutes to 2 hours. The first picture shows the normal pulp placed in hypochlorite, which is completely dissolved in sodium hypochlorite solutions. Drawbacks of sodium hypochlorite. Sodium hypochlorite causes cytotoxicity and caustic effects on healthy periradicular tissues on inadvertent extrusion during the irrigation procedure. It does not remove the inorganic component of the endodontic smear layer. It has an unpleasant taste. The solution should be kept in a cool place away from sunlight. Hypochlorite accident. Accidental injection of hypochlorite into periapical tissues causes serious damage with excruciating pain, periapical bleeding, ecchymosis and swelling. Advantages and disadvantages include advantages: dissolution of organic tissues, antibacterial action, lubricant action and economical to use. Disadvantages are irritating to tissues, bad odor, can damage clothes and corrosive to instruments. EDTA. As always referred by its acronym, EDTA is another commonly used irrigant and is often employed in combination with hypochlorite. This chelating agent was introduced in endodontic practice by Nygaard Osby. Mechanism of action. EDTA forms a calcium chelate solution with the calcium ion of dentin. The dentin thereby becomes more friable and easier to instrument. This solution removes the inorganic component of the endodontic smear layer. EDTA as an irrigant employed alone is ineffective, and hence it is recommended to be the final irrigant for removing the inorganic part of the smear layer after using hypochlorite for removing the organic part of the smear layer. The recommended volume and contact time to safely remove the smear layer without over-eroding dentin is 17% EDTA at a volume of 1 ml for 60 seconds. Interactions. When mixed together, EDTA limits the effectiveness of hypochlorite by reducing the amount of free chlorine needed for the mechanism of action. In combination with EDTA, chlorhexidine produces a white milky precipitate related to the acid-base reactions. Chlorhexidine digluconate. Chlorhexidine is perhaps the most widely used antimicrobial agent in antiseptic products. It's a cationic bisbicarbonate, acts both as an irrigating solution as well as intracanal medicament. Mechanism of action of chlorhexidine. It possesses a broad spectrum of antimicrobial activity. It also possesses bacteriostatic and bactericidal activity. It permeates the cell wall or outer membrane, gram-negative cells, and attacks the bacterial cytoplasmic and inner plasma membrane of the microorganisms. Chlorhexidine is very effective against E. faecalis, which is one of the most common pathogens identified in the root canal filled teeth exhibiting clinical failure. The most important clinical characteristic of chlorhexidine is its substantivity, which refers to its sustained action within the root canal. The antimicrobial ability of chlorhexidine is dependent on its concentration. Hence, chlorhexidine in 2% concentration is recommended as an endodontic irrigant, while most periodontal mouth rinses employ chlorhexidine in 0.12% concentration. Limitations of chlorhexidine are: it lacks tissue dissolving ability. It does not remove smear layer. Orange-brown precipitate forms immediately when chlorhexidine and hypochlorite are mixed together. It may contain a toxic substance called as parachloraniline. Itridonic acid, also called as HEBP, is a weak chelator and a potential alternative to EDTA. HEBP does not interact with sodium hypochlorite and thus can be used in conjunction with hypochlorite. Iodine potassium iodide. Iodine compounds are among the oldest disinfectants still actively used. Iodine is less reactive than the chlorine in hypochlorite. However, it kills rapidly and has a bactericidal, fungicidal, virucidal and even sporicidal activity. These iodine compounds are broad-spectrum antimicrobial irrigants used in concentration of 2 to 5% in endodontics. A potential disadvantage is a possible allergic reaction in some patients. Other recently introduced irrigants are MTAD, tetracline, Q-mix, electrochemically activated solutions, photodynamic therapy, antibacterial nanoparticles, photon-induced photoacoustic steaming, ozonated water, gentle wave irrigation, and other herbal irrigants like Triphala, green tea, polyphenols, etc. MTAD. It is a mixture of doxycycline, citric acid, and a detergent. It is an endodontic irrigant with antibacterial properties along with the ability to remove smear layer. Tetracline, like MTAD, is a mixture of antibiotic, an acid, and a detergent, polypropylene glycol. However, the concentration of antibiotic, the amount of doxycycline is reduced to a third, that is 50 mg per 5 ml. Next slide. Q-mix. Composition of Q-mix contains chlorhexidine analog, triclosan and EDTA as decalcifying agent. It is recommended to be used as a final rinse after hypochlorite irrigation for its antimicrobial and smear layer removal properties. Antibacterial nanoparticles are metallic nanoparticles of titanium, gold, silver, zinc and copper having attracted particular attention with different physical properties such as its ultra small sizes, large surface area, increased chemical reactivity and widespread antimicrobial effect. Photodynamic therapy. It's a two-step procedure that involves application of a photosensitizer followed by light illumination with visible light energy, typically in the red or near infrared regions of the sensitized tissues, which would generate a toxic photochemistry on target cells, leading to inactivation and death of microbial cells. Photon-induced photoacoustic steaming. It is based on the radial firing strip tip with laser impulses. These impulses induce interaction of water molecules with the peak powers of 400 watts. This creates successive shock waves leading to powerful steaming of antibacterial fluid located inside the canal with no temperature raising. Unlike the conventional laser applications, the unique tapered PIPS tip is not mandatory to be placed inside the canal but rather in the pulp chamber only. This can reduce the need for using larger instruments to create larger canals so that the irrigating solutions used during treatment can effectively reach to the apical part of the canal and also canal ramifications. This procedure can effectively remove both vital and non-vital tissues, kill bacteria and disinfect dentin tubules. Gentle wave irrigation. The multi-sonic waves are initiated at the tip of gentle wave handpiece which is positioned inside the pulp chamber. It delivers a stream of treatment solutions from the handpiece tip to the pulp chamber while excess fluid is simultaneously removed with inbuilt vented suction through the handpiece. Irrigation guidelines. Instruments required are the following. Disposable local lock syringes. These syringes should be color coded for different irrigants. Close-ended 30-gauge side-vented needles for apical third irrigation. Open-ended 25 to 27 gauge needles for coronal and middle third root canal irrigation. This picture shows an open-ended 20-gauge irrigation needle expressing the dye forcibly in an apical direction compared to a side-vented 28-gauge needle expressing dye in a lateral direction with minimal apical involvement. Technique of irrigation. Use of rubber dam is mandatory for irrigation. Use separate color-coded syringes for different irrigants. The tip of the needle is placed near the root canal orifice and sodium hypochlorite irrigant is discharged until it fills the pulp chamber. All needles, irrespective of the gauge and design, should be inserted passively without binding to the root canal. The objective is to irrigate the canal but not to force the solution under pressure into the periradicular tissues. During the shaping and cleaning of the root canals, care should be taken that the canals are always full of fresh solution. Irrigation should be followed by thorough drying of the root canals after the completion of shaping and cleaning with absorbent points. Common irrigants that are currently used during cleaning and shaping include hypochlorite, chlorhexidine, EDTA and MTAD. None of these irrigants has the characteristics of an ideal irrigant. Sonic and ultrasonic vibrations alone or in combination with antibacterial irrigants have been used to increase the efficacy of these irrigants. These are the references used for the topic. Thank you for watching my class.